Remember to subscribe and make sure to hit the bell icon so you never miss any updates from First Cry Parenting, especially when it comes to essential topics concerning your health and well-being. Depression during pregnancy is one of those deeply important subjects that deserve attention, understanding, and care. Though depression can affect anyone at any time in life, pregnant women can be especially vulnerable due to the profound hormonal shifts and emotional changes that accompany this critical phase. When a woman is expecting, her body goes through an enormous transformation, not just physically but mentally and emotionally, and these changes can sometimes contribute to the onset of depressive symptoms. Depression isn't just about feeling sad for a while, it's a serious condition that can take over how a person thinks, feels, and acts. During pregnancy, the anticipation of labor and childbirth, coupled with fears about parenthood, responsibility, and lifestyle changes, can further compound stress levels. Additionally, certain risk factors may elevate the likelihood of developing depression during this time, including a personal or family history of depression, exposure to past trauma or abuse, and a lack of support, whether emotional, social, or financial. Women who face an unplanned pregnancy might also struggle more emotionally, as they may not feel fully prepared or supported. Tensions in a marriage. It might influence everything from sleep patterns and eating habits to energy levels and emotional stability. The experience can be exhausting and overwhelming, with feelings of hopelessness creeping in at a time that should ideally be filled with joy. It's not uncommon for pregnant women to feel unusually fatigued, anxious, withdrawn, or emotionally unstable, and if these symptoms persist or interfere with day-to-day life, it could be a sign of clinical depression. Some women may have had previous experiences with depression, either during childhood or in early adulthood, which increases their susceptibility during pregnancy. Others may encounter depressive symptoms for the first time while they're expecting. The hormonal and psychological fluctuations that naturally occur in pregnancy, along with the rapid physical changes like weight gain, discomfort, sleep disturbances, and appetite variations, can sometimes disrupt emotional balance or partnership. Ongoing stress related to work or home, and unresolved issues can all add up to a situation where the emotional burden becomes too much to handle alone. Some women may be coping with grief from a past miscarriage, stillbirth, or abortion, which can resurface during a new pregnancy and create additional layers of sadness and anxiety. Depression might manifest in many ways, and it's crucial to recognize the signs. If a pregnant woman finds herself frequently irritable or on edge, unable to concentrate, uninterested in her usual activities, or overwhelmed by persistent sadness and crying, she could be struggling with prenatal depression. A constant feeling of tiredness, a lack of motivation to engage in even simple tasks, and a pervasive sense of worthlessness may also be present. Sleep may become disturbed either with an excessive need for rest or an inability to fall asleep despite exhaustion. Similarly, eating habits may shift dramatically, with some women losing their appetite altogether while others may begin to overeat as a coping mechanism. Another common symptom is a sense of anxiety that feels all-consuming, making it difficult to relax or feel at peace. If these feelings persist, it is important to seek help because untreated depression during pregnancy can have significant consequences for both the mother and the baby. For the mother, complications can include preeclampsia, which is characterized by high blood pressure during pregnancy, along with increased nausea, vomiting, and physical discomfort. There is also a higher risk of developing postpartum depression, which can affect a woman's ability to bond with her baby and care for herself after birth. Furthermore, depression during pregnancy can contribute to premature labor and result in the delivery of a baby who is underweight or born before full term. Babies born to mothers who were depressed during pregnancy may also be more irritable, fussy, and harder to soothe than those born to mothers who did not experience depression. These babies might cry more often and sleep less, which can make early parenting even more challenging. In some cases, women may be prescribed antidepressant medication to manage their symptoms, but it's essential to understand that not all medications are safe to use during pregnancy. The decision to take antidepressants should only be made in consultation with a qualified medical professional who can assess the severity of the condition and evaluate the risks and benefits. Some medications might pose a risk to the unborn baby, so it's important for expecting mothers to be completely honest about their symptoms and any other medications they are taking. Fortunately, there are also several natural methods that can support emotional wellness during pregnancy. Depressive thoughts by helping women stay grounded and connected to the present moment. Support from loved ones is equally critical. Having a friend, partner, or family member who listens without judgment can provide comfort and reassurance during vulnerable moments. If possible, joining a support group for expectant mothers or speaking with a therapist who specializes in prenatal mental health can offer additional outlets for processing emotions. It's important for pregnant women to know that they are not alone and that asking for help is a sign of strength, not weakness. Depression is a medical condition, not a personal failing, and with the right support and treatment, recovery is entirely possible. Many women who receive timely help for prenatal depression report feeling significantly better within just a few weeks, and they are able to fully enjoy the remaining months of their pregnancy and prepare for motherhood with renewed confidence and clarity. Open communication with a healthcare provider is key. They can provide a proper diagnosis and recommend the most appropriate treatment plan, whether that involves therapy, medication, lifestyle changes, or a combination of all three. The earlier depression is identified and addressed, the better the outcome will be for both mother and child. Untreated depression can lead to complications that extend far beyond pregnancy and childbirth, affecting the early bonding experience and potentially influencing a child's emotional development. But by paying attention to the warning signs, making self-care a priority, and seeking help without delay, it is entirely possible to navigate this challenging experience with hope and healing. Every pregnancy is different, and so is every woman's emotional journey through it. While some women may breeze through without any psychological distress, others may find themselves struggling despite having wanted and planned their pregnancy for years. No matter what the circumstances are, what matters most is that women feel empowered to speak up, ask for support, and access the resources available to them. Whether that means talking to a trusted friend, reaching out to a doctor, or simply acknowledging their feelings without judgment, every step toward understanding and healing makes a difference. Emotional well-being is just as important as physical health during pregnancy, and tending to one's mental state is a vital part of ensuring a safe, healthy, and joyful transition into motherhood. As we continue to spread awareness about prenatal depression and dismantle the stigma surrounding it, more women will be able to receive the care and compassion they deserve during this transformative time in their lives. Let this be a reminder that your mental health matters, and with the right guidance and attention, brighter days are absolutely within reach for you, your baby, and your growing family.